So is that something, if your person's walking around, they don't have any obvious apparent to them vision problems, is it something you would recommend the average person get checked maybe once a year, once 2 years?
Yeah.
Do you have a screening recommendation?
Mostly, I would say, especially as you get closer to middle age, once a year is probably the best course of action for, routine health checkup. Optometrists do a great job doing that, playing that role as well. But if you're really young, like in your 20s, and you've already had some eye exams before that have been normal, pressure's been normal, everything looks perfect, it's okay to go a couple of years in between unless there's any specific new problems. But as you start to get to the range where people need reader glasses or things like that, usually once annual at a minimum is what I would recommend.
Makes sense. So if somebody has glaucoma, one of the common versions here, is that treated just with eye drops? I mean, are there medicines that all you would need?
So there's a huge range of treatments, actually. So for very early and mild stages, oftentimes it's a single eye drop that you put in your eye at night before you go to bed. And that's it. And it's very, that's where we like to treat glaucoma, when it's in those stages where you get a good response from the medication. There's many, many, many eye drops out now that help with glaucoma. There's laser procedures too, which I do to help treat glaucoma. And then now more and more, there's these minimally invasive surgical procedures to treat more advanced stages of glaucoma too. So
Gotcha. So tell you what, I'm gonna talk about that with the surgery part.
Sure.
There's other things that it sounds annoying, but if it's you, it's pretty bad. There's things called dry eye.